Look at you silly boy.
On this episode,
What have you done?
brave little UK kitten Colin has suffered a nasty injury.
You can clearly see that the head's not attached to the femur anymore.
Will expat Aussie Dr. Scott be able to save him?
Ouch.
Let's get these ears sorted out.
Kate is shocked at Hendrix's worrying condition.
Holy moly.
I'm actually quite scared about this one.
And Alison is way out of her comfort zone with a massive 600 kilo patient.
You're a bit feisty, Boris. You're giving me that look.
Come on, there's your girls.
Here he is.
Hello, gorgeous boy. What have you done?
At Scott's Isleworth practice in the UK, worried owner David has rushed in with 6-month-old Colin after the kitten suffered a mysterious accident.
Look at you silly boy.
He's been going outside for 3 weeks. When I got home today, this morning, I basically found him in my bedroom cupboard, cowering in the corner. He's clearly in pain. It's a horrible thing to see. You know, he's got so much love in him. He's like part of my family.
X-rays show all too clearly just how much damage the tiny kitten has done.
You can clearly see that the head's not attached to the femur anymore.
Wow. He's done a real job on himself, hasn't he? Ouch.
Poor little Colin has suffered a major fall and he has quite a significant fracture. It's basically present in the femoral neck, which attaches the ball of the ball and socket joint, which is the hip joint, to the hip bone, which is the femur.
Let's just see what we've got here. So that's the leg you don't want to put down, isn't it, mate? Yeah, so very, very tender. Yeah, just really doesn't want that to be extended, does he? Oh, buddy. Poor thing. Well, we've got one good leg and we can fix this one.
Cats are so tough, they're so resilient, and they'll put up with a lot of discomfort, but it's very clear that this poor little kitten is suffering and the injury is severe.
So he's really young, isn't he?
Yeah, he's 6 months old.
Should we
Yep.
give him an anaesthetic and get him on his way?
Scott is going to have to perform urgent surgery on the tiny kitten to try to give him a fighting chance of regaining use of his shattered hip.
The procedure that we're going to be performing on Colin today is called a femoral head and neck ostectomy. We're basically going to be removing the ball of the ball and socket joint, so his hip will then be free floating. It is a major surgery.
Just a scalpel blade, please. What's quite scary is behind the hip joint is some really big blood vessels and some very important nerves. And if you happen to go through and cut them, then there's a chance that Colin will be paralysed and also could bleed out. So yeah, there's some concerning bits of structure that I need to avoid. Oh, buddy, poor thing.
There you go.
Got Hendrix here to see Dr. Kate.
No worries, take a seat, she won't be long.
Cool, thank you.
At the Bondi Vet Hospital, Emily and Dave have just arrived with Groodle Hendrix.
Oh, he's very sweet, aren't you, Hendrix?
But looks can be deceptive because Hendrix has an embarrassing problem.
So Hendrix has had a really itchy, horrible ear for a while now. It's probably been a month, I reckon.
Yeah.
And it stinks.
Hey guys.
Hi.
Hey Andy.
Hello.
How are you? Are you good? As soon as you walk out into that waiting room, Hendrix is itching his ears. They are so itchy.
In we go. Let's get these ears sorted out.
Come on, buddy. So he's got bad ears.
Yeah, this has been a while as well. I think it's got worse.
Okay.
So it's quite smelly for a start, and then the itching's just got quite intense. And even though like we've been cleaning his ears, so I think it hides the smell a bit. But he's rolling around, kind of bashing his head on the floor.
Yeah.
I think it smells like fish, but you think it smells like cheese.
Cheese and Vegemite.
Oh, buddy, come on, little buddy. Oh,
What is he, 17 kilos?
17 kilos.
So good.
Good boy.
Now guys, you tell me that he's quite a swimmer.
Yes, he loves to swim.
Okay. He's got beautiful teeth,
That's good.
beautiful long eyelashes.
Yeah, I think we might
Holy moly.
Is there Toey?
At the Australian Reptile Park, there's movement at the swamp, and the alligators are sensing that something's up.
Over to Tim.
Go ahead, mate.
Hey mate, looks like we've got a tree down on the ramp on the Alligator lagoon that's going to need removing, and probably have to have a really good look at the ramp itself as well.
Yeah, see you soon. Fallen trees are a pain in my butt. But when I hear that one's fallen on the gator ramp, which is a pretty important bit of structure, right? We feed the gators off it. If the ramp gives way, that's us in the water. So sounds like we've got to get rid of a tree and have a look at our ramp. When did that come down?
Not sure, must have come down last night sometime.
Yeah, and it's on the ramp.
Yeah.
The gators aren't minding it.
No, not at all.
Paper, scissors, rock for who's moving the gators. Ha! Yes! Got a couple of sticks?
Yeah, mate.
Yeah, nice. It's the time of year when the gators are still sunning themselves. You know, it's warming up and they're really soaking that in. There's a couple sitting on the ramp right where the tree's fallen.
Do you want to do rock, scissors, paper again?
Nah, you're up, mate. Cheers. Come on. So first thing is to move those gators. Come on, girls. But they are not to be underestimated. Off you go. Off you go.
Come on, big girl. Come on.
I know you don't want to go in, but you have to. Off you go. Wrong place, wrong time. Come on, you.
That's the leg you don't want to put down, isn't it, mate? Yeah, just really doesn't want that to be extended, does he? Oh, buddy. Wow. He's done a real job on himself, hasn't he?
In the UK, Scott is about to perform major surgery on 6-month-old Colin after the tiny kitten fractured his femur. It's delicate surgery on such a tiny cat.
That's the fracture site there, and then we've got the head. The added difficulty is that the femoral head is attached to the pelvis with the round ligament. So it's almost like if you're bobbing for apples, but the apple is tied to the bottom of the barrel. Still holding on by a little thread. There we go. So there you have it. But that's the tricky bit, you see, because that's blind. So you have to get behind it to cut it.
It's a relief that the first part of the surgery has gone well, but now Scott has to work on the end of the femur that the ball was connected to.
So this bit here is where the fracture was. So what I'm trying to do is now I've taken the ball away, then this bit I just want to smooth off. Just so it's nice and smooth, it doesn't touch Colin's pelvis, and he's a very comfortable boy. You know, this poor boy's been through enough. The last thing he needs after this surgery is to be uncomfortable still. So just got to get it right for him. This is the rest of his life, you know.
Scott will have what's called a free-floating hip, where his leg is no longer attached to his pelvis.
I can imagine that people think that this type of surgery would leave the leg all loose and dangling, but animals are such incredible creatures, and what happens is that the muscles will take over the support of the joint. And a young nimble cat like Colin, well look, he will soon be walking again just fine.
So we'll just do one more flush, please. Thanks. Okay, it's done. All right, let's wake little Colin up, shall we?
While Colin slowly comes out of the anaesthetic, Scott checks x-rays on his handiwork.
Looks pretty good. This is a normal hip joint, so a ball and socket joint. And so it rolls in there, and then you've got all the musculature that moves it around. In this case, we no longer have a joint, but the muscles are still all attached to all the same places, so they'll still move the leg in the same way. So therefore, he can run around perfectly fine. Such a sweet boy. Poor little man. Stay there, good boy. Okay. That's a good boy.
So he's got bad ears.
Yeah, it's quite smelly for a start, and then the itching's just got quite intense, and he's rolling around, bashing his head on the floor.
Yeah.
I think we might need...
Holy moly.
At Bondi, Kate has just discovered why Groodle Hendrix is having so much trouble with his ears.
They're very infected.
Are they?
Yes.
Owners Emily and Dave say the ears smell, and Hendrix is constantly scratching them.
Ooh, stinky. Very, very stinky ears. It's not very good, is it? You know, these guys described it really well when they said it smells like Vegemite. I always encourage people to get used to what normal ears smell like. This is not normal. This is definitely not normal ear smell. Is it, Handy?
It's just a bit of a surprise. It has been smelly a while, so it's good to understand what it could be, but didn't think it was going to be a serious ear infection. We just thought maybe we haven't been putting his eardrops in properly.
So all of this here should be probably not as white as he usually is, but this here shouldn't be this dark. So the reason that the drops are not doing anything is because you probably got like a water-based drop, and a cleaner is not going to fix an infected ear. He's got these really long ears. They never get any air. Water mixed with no air becomes a recipe for ear infection. Oh, Handy.
Poor little Hendrix.
This would be so uncomfortable, and the only thing that I can think of is if you have some kind of intense itch, like an itch at the bottom of your foot, and you had to put it into a shoe and not itch it like the whole day. Like, that's what it would feel like. It would be so, so itchy. If I do this to Hendy, he'll be like, that is so good.
Yeah, he loves that.
Because it's so itchy. So what we're going to do, we're going to take a little sample of these ears, and I'm going to have a look at it under a microscope.
Yep.
And then what we're going to do, we're going to actually put something down there that will work.
Okay, great.
Okay? We could be dealing with multiple things. We could be dealing with certain types of bacteria.
Ooh.
We could be dealing with certain types of fungal infections. And what we need to do, we need to establish what this is, so I can then decide what I'm going to use to treat this particular ear infection. So we're going to stain these, and this allows us to actually get some colour on whatever's going down in those ears. Yep, the good news is that there's no bacteria down here, but the bad news is there's quite a lot of fungus. That's not good.
Not food. I know you don't want to go in, but you have to. Wrong place, wrong time.
At the Australian Reptile Park, Tim and Obi are trying to fend off massive alligators so they can assess a large tree that's come down across a feeding ramp.
I know you're sunbaking and you don't want to, mate, but off you go, please. Come on.
Round to the water. Come on. Keep going.
There's 3 on the ramparts.
I think you're going to take this job, aren't you?
No, I got my own.
Come on.
Well done. Go on, off you go.
All right, you 3. Time to get off.
Come on, you lot.
Come on.
Come on, off you go. Mate, they're like dinosaurs today.
Come on.
There's one. The tree obviously has to go, but it's hit the ramp. And what we need to assess is if it's done any damage, because that ramp is critical. We feed the gators from it. If it collapsed, our staff fall in the water to 40 alligators.
Come on. Come on.
Come on, mate. Off you go. Well, one behind us here, Obes wants food.
Hey.
You watch that one?
Right,
Come on. Off you go. Off you go. Well done. Well, this hasn't hit too hard, but enough to take a bit of bark off.
Yeah, definitely.
And the tree's got to go. Righto.
Get the chainsaws, eh?
I think so. Maybe you want to get a bit of gear and I'll rally the troops?
Yeah, no worries.
A job like this, where we've got 40 gators around us, it's easy just to get a team in, cut it up, a couple of eyes on the gators, get the tree out. It's a nice, quick process.
It might be quick, but with deadly spectators, every minute counts.
Oh, there's a bit of weight to it. Obi, there's a couple behind you. The tree's gone and we're looking at the ramp. The timber has been hit and broken, but pretty superficial. I'm far more worried about what's under the timber, the structure of the ramp. I think it's timely just to have a bit of a look at the supports anyway.
Yeah, I would like to before we start feeding.
Yeah, I bet you would. I think the easiest thing now is to go and get the boat, paddle out, and try and see if we can get a bit more of an idea of what's happening under the water. The big fella's next to it.
Dan, it's yours.
He's yours, Dan. Dan, Obi and myself walk around to collect the boat, and we've got this gigantic male gator just sitting right there. Come on, big fella.
Dan attracting the girls.
Whoa, look at him. Woo! Do you want to just give me a tap with that and I'll get his tail?
Come on, big fella.
Ready? 1, 2, 3. Again.
That's it.
1, 2, 3. This gator would weigh somewhere between 200 and 300 kilos. He is a big boy. He wouldn't budge. Watch out for him to swing. Nah.
Come on. Come on. Ready? Wait.
Well, that's not working, mate.
We're going to take a little sample of these ears and I'm going to have a look at it under a microscope.
Yep.
The bad news is there's quite a lot of fungus.
In Bondi, Kate is getting a close-up look at the culprit deep inside Hendrix's ear that's causing him so much discomfort.
Fungal infections, they love moist areas, and so anywhere that's wet, like Handy's ears, is a great place for them to grow. So we need to stop this in its tracks. Oh, Handy. Primarily what we've got is what they call a Malassezia infection. So it's otherwise known as yeast, right? Yes, that's the smell.
Yes.
So the first thing we're going to do is we're going to take out all of those clumps of fur that are growing down Hendrix's ears. Oh, sweetheart, I know. Be careful, be careful. You're very patient. I know you are. And then we're going to give them a good clean. That ear is already starting to look better and I haven't even done anything yet. I think the most important part of this is getting owners to recognise early when there is a problem. Ooh, that's what's coming out. Rather than letting it get to a point where it's a total mess, having it so that they can actually smell these ears and be like, that is not normal Vegemite ears, let's go to the vet. This is your drops, right? These are antibiotics as well as an antifungal. It's just a gentle resting, so resting like so, right? You don't have to push it all the way down.
Yep.
And you need to do a really nice, good squeeze down there, okay?
Good boy.
And then
Yeah. But nice.
you okay there?
Shake his throat.
Oh. We've kind of felt it that he's not been quite himself, so I think it'll be good over the next few days just to see him feeling a bit better.
Okay, like a nice head massage. Oh, so good. So good.
You still can't go swimming for 14 days?
Well, honestly, I wish he wouldn't swim for 2 weeks while I'm trying to use the antibiotics and the antifungals down these ears.
Come on then. Good boy. Whoa.
See you guys.
Bye, thank you so much. Thank you.
Good luck. Call me if you need anything.
Will do.
Bye,
Thank
Handy.
you.
Don't shake your head.
Good boy.
Today, mobile vet Alison is swapping the city for rural Queensland, and an interesting challenge.
Brad, who's the founder of Animal Farm Rescue, has just given me a call. He's got a patient that he urgently wants me to check out.
Brad runs a cattle property, and one of his steers is in trouble.
Hi Brad, how are you? What a beautiful location we're in. This is just stunning. Look at this view.
Welcome to Farm Animal Rescue.
Thank you for having me.
Yeah, we don't really sort of notice it so much anymore.
It's stunning. The drive here was just beautiful. It's like out of a storybook. I hear you've got an interesting patient for me today.
We do indeed. We've got Boris ready to go. And his problem is that he's got a horn that's about to grow into the side of his cheek.
Oh dear. Okay, let's go check him out.
Sure.
Brad tells me that today we'll be treating his steer. I'm automatically a little bit nervous because I know these are big animals and I'm not used to treating them every single day. And here he is. I'm anxious, but I'm also very interested to see what we'll be doing. You can definitely see that that left horn is quite abnormal. So what's been going on?
Well, we picked up about 4 or 5 months ago that we were a little bit concerned about the direction that the horn was going.
Yeah.
So we've been monitoring, but as you can see, it's now at the point where he could start to get the horn actually growing into the side of his cheek, which of course we don't want.
Right there, isn't it? It's very, very close. And compared to the other side, I suppose the other side is further set.
Yeah.
So, and it's not growing into the face, whereas the other one is actually poking right in.
Exactly right.
Yeah, that's in a dangerous location, buddy. We really do need to do something about that horn straight away.
He's quite a fierce guy. He's quite happy to just come up and just push you.
Ah.
So if he's hungry, he'll just come up and he'll just push you from the front. But the problem is that a gentle push for him, of course, has 600 kilos behind it.
Okay, you're a bit feisty, Boris. Does that mean we've got our work cut out for us today? You're giving me that look. I'm actually quite scared about this one.
Watch out for him to swing. Nah.
At the Australian Reptile Park, Tim and his team are venturing into deadly alligator territory to try to get a closer look at a damaged ram.
Ready? What's here? Well, that's not working, mate. Let's just get the boat.
Walk around him. You can stay.
Hold on, we're on that shelf. Wait! Oh, did we put the bung in?
Yeah, bung's in.
Bung's in.
Venturing onto the water is risky, but it's the only way Tim will be able to get a closer look at the damaged feeding ram.
When you're in a boat in the middle of a swamp and there's 40 alligators, you need to have your wits about you because gators still have one of the strongest jaw pressures on Earth.
Oh. Well, watch this big fella, mate.
If your hand goes in or your body goes in, don't worry about just the damage from the bite, but they're going to hold on and take you to the water and try and take you under.
Did we just go over a gator?
This ramp is a life support system. Now we got Ranger Mick and the team out there feeding these gators from the ramp. If the ramp goes, they go. And where they go is not a good place to end up.
With the paddle, I'm just feeling the edge of the post. What we want to know is the integrity of the post underwater where we can't see. I really can't feel much with the paddle or see anything because the water's like coffee. But the first thing that you want to do is put your hands in and have a feel, and we can't do that, but we need to.
I think the only choice is to get in the water. I don't like getting in that water, but what I would like even less is for someone to fall off the end of that gator ramp while they're feeding 40 gators. So there's a balanced risk there, and the best thing to do is me to jump in and have a look.
Brendo, you know where the fence panels are?
We don't just have a gator cage lying around. This is a unique job. So I've asked the team to go and grab some fence panels. You know, about the right size, about the right height. They should do the job to be able to create a cage.
You got him, Bren? Righto, next panel. Anyone got a tiny bit of rope, cable tie, something like that? Oh, you a beauty. We work with animals. That doesn't mean we're good mechanics.
Jesus, mate, we're about to go in.
I don't feel comfortable. We don't know what the gator's going to do, so please, eyes and ears out. Someone look on that side, someone at the end, someone this side. And if there's a gator, no practice runs, only real deal. If there's a gator, sing out.
We've probed around with the paddles, you know, we're pretty comfortable, but that's no guarantee that a gator's not going to be sitting on the bottom.
So let's get this over with.
I've got 2 protectors on the water, and I've got 3 spotters on the ramp. I just want to get in and get out.
Good luck.
They're right there.
Good luck, mate.
See you later.
A few bubbles to you, right?
Bit cold, mate?
Cold? Tim, don't move, mate. Stop moving.
Suddenly, Tim's ramp inspection has turned deadly, with massive gators moving in to check out the intruder.
It's only a couple of metres. Oh, yep, got him.
He's coming.
Come on.
Hey David, how you doing?
Hi Scott, you okay?
Yes, very well.
In Isleworth, it's been an anxious wait for worried owner Dave, while Scott performed major surgery on his precious 6-month-old kitten.
From a completely healthy cat to having a major orthopaedic surgery, it's a bit of a shock.
Yeah.
But you know what? We've sorted it. So come on in. Here's your guy. Look, he's here. You okay? Oh, he loves you. You can tell.
He's so cute. You know, everything's on his terms. When he wants love, he just basically jumps all over me. When he doesn't, he you know, does his own thing. I can't really imagine not having him now. He's a really sweet boy.
My hope for Colin is that he will respond really well to this surgery. He'll have to begin to use that leg, but he'll learn to use it in a really different way. But he is a young cat, so hopefully he'll just bounce back and soon be bounding around the streets of Isleworth again once more.
Good luck.
They're right there.
Good luck, mate.
See you later.
At the Australian Reptile Park, Tim is doing the unthinkable.
You right?
Going into the swampy lagoon, which is home to 40 deadly alligators. It's the only way to properly assess the damaged feeding ramp.
When I go under, the seconds feel like minutes. There's not a second I'm in the water that I'm not thinking gator.
Tim, don't move, mate. Stop moving. Oh, yep, got him.
I hear a noise, I jump. If my foot touches a rock, I jump. But I just focus on the job, keep the hands on the post, and have a look at its integrity.
That one's good.
That one's good?
That one's good.
Cool.
Yep, all the way to the bottom. It is actually a little bit rusted.
Yep.
Not too bad, but I can pull a few corroded bits off.
No gators?
No gators.
Good.
Can I go under again?
Yeah, you go now, but hey, little girl, right at the boat. Oh!
Tim now needs to inspect a second post, but more gators are moving dangerously close.
Oh, it's good.
You all right?
Yeah.
The big male's coming, Tim. Come on.
Take a deep breath, Tim, he's coming.
I'm in the water, I hear someone say gator.
Yeah, stay there, stay where, got you, but they're coming, mate.
It's at that point, I'm pretty nervous, but I just trust in the team that they're gonna keep the gators away.
Those vibrations are really getting them going. Oh, yep, off, oh.
Oh, watch one behind you there, Danny. That one's coming in hot, man.
I've got girls trying to jump at me.
Get me out of there.
Yeah, you're right, good, go. Yep, go.
When I got back out of the water, back in the boat, it was a great feeling.
Beautiful. They're coming.
Yeah, we'll hold this boat in, don't move it. But then we're out, there's a whole bunch of other commotion and the gators are back at it again.
Whoa. Out of here, please, no more. This is ridiculous. Whoa. Whoa, watch out. Watch out.
Keep away, mate.
Watch out. Whoa. Someone's watching my back, yeah?
I think we're good on this side.
Get us out of here.
One thing left to do, and that's get the boat back to where we started. And we've got a whole swathe of gators any direction we turn.
Watch out.
Oh, sorry, mate. You all right? Today was a success. Team safe, we got the job done, and I'm happy that no one's going to fall off the end of that ramp into 40 hungry gators.
Just watch that, boy. Yep. Thank you, fellas.
go. Good girl. Let's go see Auntie Audrey.
In Sydney, vet nurse Bree is arriving with Audrey's next patient, 12-year-old Rottie Coco.
Auntie Audrey.
Hi,
Look who it is.
How was she for pickup?
Oh, she was an angel. She's so good.
Gentle Coco has a big problem that needs urgent attention.
So we're in today to remove that massive lump.
Yes.
Now, I've been seeing Coco because there's been this lump on the back of her thigh, or more near the base of her tail, and it's growing. It's growing really quickly, and it's now starting to press on all the areas that is causing pain when she's walking or getting up.
She doesn't like it when we touch it, I don't think.
Audrey is hoping it's a fatty mass called lipoma, and nothing more sinister.
So you can see it's coming, it's almost lobulated, so it's got a big one here that's pushing her tail back, and then it's actually extending all the way here. So if I grab it, we're looking at a lump the size of half your head. I'm concerned because it's so big, but also it seems to have almost two lobules to it, one going over the thigh and the other one going towards the bottom. So Brianna comes up with a cute little phrase, we call it the double bubble butt. So Coco now has a double bubble butt. And just the position of it, it's kind of in an odd place where it's pressing on her hip, it's pressing on her bottom there, so that might start to affect the way she can go to the toilet.
That's what Mum was saying this morning. So they're really quite worried about it.
Anxiously waiting at home is Coco's worried mum, Duo Lee.
We've had Coco for 12 years. We've had her since she was 8 weeks old. She's a big part of our family, and we really hope we can remove this lump and she gets back to her old self.
You can see how big it is because her actual tail just bent to one side, so it's asymmetrical now, and then that lump is huge.
I know. Come on.
Come on, beautiful. Let's get that double butt off.
Getting sleepy.
So we give Coco the general anaesthetic through her vein.
You're so good.
She goes to sleep. And then we have to lift her onto the table to connect her to the anaesthetic gas. Both me and Bree found our muscle power.
Yes. That butt weighs like 3 kilos.
So we've got Coco under general anaesthetic, so she's on the oxygen and the gas.
Suddenly, Coco's in trouble.
She stopped breathing. She's not breathing in the gas. That's what
You're giving me that look.
In rural Queensland, Audrey's twin sister Alison is face to face with her largest ever patient, a 600-kilo bull called Boris.
I'm actually quite scared about this one.
Boris's left horn is growing dangerously close to his face and urgently needs to be trimmed back.
Well, it definitely looks like I have my work cut out for me. I am going to have to ring in the forces, phone a friend, see if I can get some help today. So I give my friend Malcolm a call, who's a large animal vet, and thankfully he's free today, so he's going to be coming straight here to help me. Okay, this is where Boris is at the moment. He thinks it's a piece of cake. I'm a little bit more nervous, but I feel happy that he's here today to talk me through it step by step.
Hey, big guy, how are you?
So as you can see, the left horn is the one that's dangerously close to that cheek. The right one's also growing downwards, but it's set further aside, so Brad's definitely worried about that left one.
Yeah, it's not touching yet, but I guess at some point it's going to start poking him in the face, which is going to be unpleasant for him.
Unpleasant and uncomfortable.
Yeah. My first impression of Boris is that he's a big lad. If he doesn't want to do something, it's going to be hard to get him to do it. Usually the easiest way with these big, thick horns like that, we use something called fetotomy wire or embryotomy wire. Yep. Some people refer to it as piano wire, so it just uses friction just to saw off the horn. Of course, he's not going to be all that keen on that, so we'll sedate him and also do a nerve block, because there is blood vessels and nerves down the horn a reasonable distance there.
Ooh.
So,
what is he doing?
He's just coming to say g'day.
Okay.
Before he is sedated, Boris is being shepherded into a crush.
That's the way, Boris. Keep going, matey.
Which will hopefully keep him still during the procedure.
Beautiful.
Is he going to flinch?
Hopefully not. Oh, there's our problem when he does that. Okay, just draw back again, mate.
Oh my gosh.
Boris.
Boris! Before we start the procedure, we need to administer a nerve block.
So we're just going to put a whole bunch of local in here. All right, go.
So that Boris definitely won't be feeling any pain.
Oh, Boris. You're still alive, aren't you, mate? So if we get it in the right spot, it's going to block the nerve to that horn. So we just need to give that a little while to work.
Okay.
So this is the wire. Doesn't feel like much there, but it
Braided.
just relies on friction. So
Malcolm brings out the embryotomy wire, which is actually the device that we're going to use to saw the horn off slowly.
we'll try not to cut anything other than the horn.
This is really just a braided wire so that when we're actually doing the action of sawing, it's producing some heat which will naturally cauterize the vessels so we don't get a lot of bleeding.
Just initially we just want to go slowly, just until we can sort of convince ourselves that it's making a groove and it's in the one spot. I think that's pretty good. I reckon you can... All right, Boris, let's move your ear out of the road a little bit.
I'm a bit worried about that ear.
No, ear's all good.
The risk associated with the procedure is that we're not quite sure how much blood is going through those horns. There could be a lot of bleeding, there could be minimal bleeding, so we really have to be quite cautious about that.
So you can really, so big long strokes now and harder and faster. Pretend you're doing your workout at the gym. We could be here a while.
She's not breathing in the gas.
Back in Sydney, twin sister Audrey is urgently trying to stabilise Coco's breathing.
That's her. It's every 20 seconds.
An anxious few minutes later, Coco's out of danger.
Look like that.
But now Audrey has to try to safely remove the massive lump on the elderly dog's bottom.
So the tricky points with this kind of surgery is you don't want to remove too much muscle around her bottom because that's responsible for contracting when she's going to the toilet. We're always worried that it could be something nasty, so more than just the lipoma, it could be a nasty type of tumour that could potentially spread. So getting it off and finding out exactly what it is very important. There's one over the hip and then it kind of gets narrower, and then there's this huge one more towards the bottom and the base of the tail. So I'll start with this smaller one. So I make my first incision and I start undermining the skin away, just trying to get to the edges of this lump. More blood. So we've got the cautery going, so that's just burning off all the little vessels that are bleeding. They're not big vessels, they're just under the skin. Good job.
An hour into surgery, Audrey is finding the lump removal tougher than first thought.
So I'm finding that this lump, it's actually quite deep. It's actually going all the way down to the muscle layer, so I can actually see it's pretty much attached to the hip. So I'm just trying to slowly peel it off.
It just keeps on going and going.
I see things that make me nervous, so right now I'm just peeling it off a vessel here. This thing needs to come out. It would be causing a lot of pressure on so many things. But it does, at this point, just look like all fat, which is great.
The lump will be sent off for analysis to make sure it's nothing nasty.
So I'm pretty happy with how it's gone. Just a small amount I had to leave in there that was attached to some big vessels, but other than that, that's all come away really nicely. And we'll just close up and pop a drain in. So it's been a pretty big day and quite an intense surgery. We do lump removals quite a lot, but this is no ordinary lump removal just because of its size. I think it weighed in at 650 grams. Now the drapes are off, you can actually see she looks like she's got a normal bottom. And I think that she'll be quite pleased that that's out and she's got her normal movement back again.
You can tell Mummy the good news. You call Mum? Best part, the recovery snuggles. I love them. Yes. Makes it all worthwhile.
After the marathon surgery, Coco will have a big sleep before going home.
Me?
You're going red, Alison.
Oh, you have no idea. Harder than it sounds.
Yeah.
Out in rural Queensland,
keep going.
Alison has begun to saw through Boris the bull's horn.
We could be here a while.
With large animal vet Malcolm standing by, she has to work quickly and carefully. The 600-kilo steer is sedated but not unconscious.
You're getting somewhere now, I think.
Oh, I can smell that.
Keep going. You're slowing down, Alison.
Mark?
Let me know if you want me to take over.
So getting actually that first groove started is not that hard at all. But when we get down to the nitty-gritty of actually getting those larger cuts through, I'm actually feeling the pain on my arms. Oh. Sorry, Boris.
No, he's not complaining. He's not feeling that one little bit. It's moving slowly. We're maybe halfway.
I'm just thinking, how can this be halfway through? I'm absolutely exhausted. It is a lot of work.
Nearly there, Boris. Beautiful. Good job, Alison.
So the horn's finally off. There's just a tiny little blood, so we're going to pop a bandage on there just to seal off the vessels, which will stop in time. Is it blue?
It's blue and pretty.
We'll also spray on some fly spray to get the flies away.
Just see if we can bandage this on here. It'll just apply a little bit of pressure. I think that'll stay on long enough to stop the bleeding.
We're really, really happy with today. It's been very, very successful.
Oh, big fella. How'd you go, mate? Good boy.
There's minimal bleeding. It's good news for us, and it's really good news for Boris.
Almost there.
Today, Audrey is making a very special home visit.
Hi, Drew. How are you? How's Coco going?
She's great. You gonna come over here?
It's been a month since Coco underwent marathon surgery to remove a massive lump, and Audrey's keen to see how she's doing.
So all her hair started to grow back, which is great. And I can see that that excess skin, because obviously it was all stretched from the size of that lump, that's all contracted in. And that's made the healing look a lot better. And even her muscle's starting to grow back on this side because all that muscle was pushed aside from that huge mass. So I'm very happy. And she's obviously going to the toilet a lot better now? Yep. Great. So every time we remove a lump, especially a fast-growing lump, we're always worried that it's nasty, whether it's spread internally and it's going to affect her quality of life. But it's a good day today. I get to deliver good news. So that lump we sent off to the lab and the results came back. And good news, it's a benign tumour, so it's a lipoma, which is basically a massive capsulated fat. So it's a good idea that we removed it, but also really good news that it's not something nasty that will spread internally.
Oh, that's great.
Yeah, good news for you, Coco. Yay! So I'm really happy with the physical exam. I'm really happy with the surgical site. It's healed well, but I want to see her going out, running around, and see how she's moving. Come here, Coco. Whee! Good girl, walking very well.
Audrey's just told me everything's fine, she's doing good. Coco's moving, running, so yeah, so hopefully we'll have Coco for another 10 years.
So very, very happy with her recovery and progress. So keep me posted, we'll keep checking in on her, and I guess, yeah, we'll keep in touch. Good news today, hey? All right.
Thank you.
See you, Coco, see you, Gio.
Bye.
Bye.
Bye, Audrey.
3 weeks later, little Colin is making good progress after Scott repaired his shattered leg.
It's a good boy.
Really nice, good squeeze down there.
Good boy.
And Kate's patient Hendrix is much more comfortable after treatment for a nasty ear infection.
Hi, I'm Dr. Alex Hines. If you love our show and you want to see some more amazing stories, hit the subscribe button. Click that little notification bell and we'll see you on the next video.